All right, everybody, welcome back. Thank you so much. Looking forward to this next panel discussion. I think this is one of my favorite discussions. It's important for me as a provider, as well, I'm sure, for all those patients out there, and how to be your own advocate. And what does that mean? And so we have a fantastic panelist of patients as well as providers, and Sarah here as well as Alicia. And so we're going to ask some questions. I'm going to start us out for the sake of time. I'm going to get things going to our patients out there, Richie and Judy and Tanya. And why is it important truly to be your own advocate? And what did you learn? What have you learned now that you wish you had learned, let's say, when you first were diagnosed with glaucoma? Richie, why don't you start us out?
Yeah, thanks, Paul. It's a great question, and I appreciate the opportunity to chat with the panel today. For me, why was it important? I was going about doing my thing, thought I had stable, albeit early onset optic atrophy that was well controlled with drops. And it was through my own advocacy that first I learned I was actually losing vision 10 or 15% by the time I realized something was going wrong. And when I wasn't satisfied with the questions or the lack of answers, I advocated for more testing, more specialized investigation of what was going on. And eventually that led to some genetic testing that provided the answers I needed. They weren't necessarily the answers I was hoping for, but at least I conclusively knew what was going on causing my vision loss. So for me, it was all about recognizing if I wasn't satisfied, I had a role to play as a patient there, as a valued member of that care team. And it was up to me to really express those concerns to the clinicians I was working with and try to figure out where we go from there.
How did you know what questions to ask? I mean, I know there's a lot of patients out there saying, I don't know what to even ask, and how do I know that I'm not getting the information, let's say, all or the full information, the full testing?
Yeah. So I knew just enough to be dangerous. When I found out I was losing my eyesight, I was actually working in full service ophthalmology, drug and device development. But because I certainly wasn't an expert, I was able to reach out to those around me that were. And I said, look, this is what's going on. What do you suggest? What should I consider? Neuro-ophthalmology is not my area of expertise for sure. So how do I navigate these questions? What kind of things should I be concerned about? And just having those conversations, being open to input from others around me was immensely helpful. The other thing that was helpful is the original hat I wore back in the day was that of a patient advocate. I'm a public health person by background and by training. So certainly comfortable reaching out and asking questions there when more often than not, I didn't have the answers myself.
That's a great point. I think I'd love to hear from Judy and Tanya. And what are some of the questions that you wanted to know right away when you were first diagnosed with glaucoma? What was going through your mind of, I want to know X, Y, and Z? What were the top things you wanted to learn?
Yeah, thanks for that question. I was diagnosed with glaucoma almost now 15 years ago, and it was by accident that they found this through my regular eye doctor, that my pressure is a little high. And by that time, I've already lost quite a bit in my right eye and quite a bit in the left. So I would say, for me, looking back, what I wish I'd known is to definitely get into like a glaucoma foundation and go into a lot of the resources that's available here, from education to, topics like today, all the complexities that go on with glaucoma. And certainly for me, I was in my 30s, and, it was like not a big deal. I didn't really feel it. And it wasn't really until, I guess, me personally feeling that I saw loss that I got more in depth into understanding what glaucoma is. So I wish I would have done that sooner. In terms of being my own advocate, certainly, nobody really knows your vision better than yourself. I also have an Icare because I've been to the Glaucoma Foundation several times for their February event. And I saw the Icare demonstrated at the second floor of the hotel, and I've used it, and that's really helped a lot in me guiding my doc about what's happening with my eye. I've had several surgeries for my eye. So one, I would say, certainly be open to talking to different docs, because I think different docs from their background would have different ways of looking at the situation. Certainly lowering IOP is really important. So I guess being your advocate, because you know your eye the best, you have to really push for that solution.
Do you feel like the education, the explanation from their eye care providers was important to allow you to understand the need and the importance of taking medications? Because we as providers feel like compliance is always an issue. It's hard to keep people on medications. And do you feel like for you, you needed to have the understanding before you were able to stay compliant? Love to hear your thoughts.
Yeah, yeah. Luckily, God was giving me a good discipline. So I've always been pretty good with my eye drops. So I say very good with the eye drops. Docs always told me, got to be on your eye drops, used to be every 3 months. But I think when I got to a certain level, I've done 2 SLTs, then I needed to have more surgery. I guess I wish my doc would have given me more of the after effects or the risks involved with surgery. Lots of different surgery options are now available. From scarring, in my personal case, is a result of the failure of the couple of surgeries. I wish that the doc probably would have given me the pros and the cons. So I guess that would be my suggestion.
I'm glad you brought that up. I'm going to bring Sarah in here real quick. I'm going to ask Tanya a question too in a second. But Sarah, Judy brought up a good point. How do you educate patients to this, especially around surgery, to give them enough information so they understand the true risks and benefits, but yet not overwhelm them? And that's a balance, I find.
Yeah, really challenging one too. I had a patient just on Wednesday who said, "Why are you telling me all of these horrible things?" And I think, it's tough because on the one hand, if you really feel surgery's right and you want the patient to proceed, it's much easier to paint kind of a rosy picture. But I think when something does go unexpected or the healing is different than anticipated, it's horrible to say, "Oh yeah, this was a possibility. We just didn't talk about it." I mean, I think it is important to try to make sure patients understand the risks and benefits. I try to use my best knowledge of the literature and also of my own surgical outcomes to try to get estimates of numbers to patients so they can put it in perspective. For cataract surgery in particular, the risk of infection is devastating. We talk about it, but it's less than 1 in 10,000, and people understand what that number means. Whereas, with some of the glaucoma surgeries, the risk of failure at 10 years is quite high. And so I think numbers can help patients understand the context.
Yeah, and you brought up a good point about confidence and using your own data. I think it's important to be objective and use data that's published, but then also tell you, but in my experience, I think, and I love to hear, all the patient's perspective, but I think they look to us to say, well, what is your confidence level? And what has your experience told you? What is the best decision to make? I want to bring Tanya in real quick. Tanya, when you were first diagnosed, what questions or what information did you want, or what did you hear from your eye care provider that made you feel like, okay, now I understand?
Afternoon, everyone, and thanks for having me. I got diagnosed pretty young. I got diagnosed between 23 and 24, thereabouts. So I was very young when I got diagnosed. And I live in a country where we have a culture where glaucoma is not that well documented here. So for me, I was shocked. There was not a lot of literature around in my country where I could actually go to get information. So what I needed to know was like, can it be cured? That was like the first thing that I wanted to know. And what can I not do? Because when you have a condition like glaucoma that steals your vision, am I allowed to do versus what am I not allowed to do? What can I eat? What sort of exercises can I do? Do I have to make any changes in terms of my lifestyle? Do I have to switch jobs? Can I manage stress? So these were a lot of life-changing questions that I had at 22, 24, and not a lot of persons. My healthcare professional at the time, she was very sweet, and she answered a lot of my questions the best way she could. But the bulk of it, because I was studying law at the time, I needed more. I needed that assertion. I needed that confidence. I need that definite answer. So that triggered me to research. So I needed to find other alternative treatment outside of what my doctor was actually providing at the time. Because standard, when you're diagnosed with glaucoma, you go on eye drops immediately. But I didn't want to live the rest of my life on eye drops because they're not very comfortable, I will tell you that. But for me, it was, I needed to know what I'm able to do now that I have glaucoma, what changes I needed to make.
No, that's a great point. I think, being, in my opinion, as a provider, I love when patients ask questions. I think it's important to not be afraid to ask your provider. If your provider does not feel comfortable explaining to you or educating you, I personally think you need to get a second opinion, because our job is to educate and that you make the informed decision, whatever that may be, whether it's laser, surgery, or drops. And I think you made a good point. And are there a couple questions that you think so some out there just got diagnosed in the audience right now, they want to know, what questions do they have to ask? Give me 3 questions that are important for them to ask their eye care provider.
Well, for one, you need to know have you have lost any form of vision first. So that's very important. For me, I needed to know, have I lost any vision? I needed to know which eye drop would be better suited for me. And I also wanted to know the expense of these eye drops, because these eye drops that we're going to be given is a life condition for glaucoma. So you need to look on the economical aspect of it. Can I afford these for the next 3 months, 6 months to a year? And how effective are these drops going to be for me? Because you have different types of drops out there, and some may be more cost effective and some may be economical, but is it beneficial for you as an individual to treat your glaucoma? Because while glaucoma is glaucoma, everyone experiences glaucoma differently. And a drop may work for you, but it may not necessarily work for me. And another thing that you need to know, you need to have a plan, have a morning routine in terms of what are you going to be eating? What are you going to be doing? That way you don't let yourself get loose, because when you don't have glaucoma, you can eat anything you want. But now that you have glaucoma, you have to pump the brakes a little bit here. You got to like, okay, I can't eat that anymore. And I'm not supposed to eat that. So you need to have a list and get your family and friends involved in terms of what you are able to eat. That way they are your support group. So when you're out on girls' night or you're out with a family, don't go eat that burger. You enjoy something else. So those are the top 3 things that I know for me as when I was diagnosed that I want to be aware of. And I'm sure others would want to do so as well.
Well, that's a great question. Great points, rather. I want to bring Alicia in here real quick. Thanks for filling in, Alicia. I appreciate that. Wanted to ask your thoughts from an optometry perspective. I know a lot of optometrists are feeling really comfortable treating glaucoma and managing following glaucoma patients. When do you feel it's necessary to think about a glaucoma specialist referral? I mean, how does that work for you and for the patient perspective?
Yeah, that's a great question. So for me, it's actually state dependent as well. So in Massachusetts, we just obtained glaucoma privileges. So in that state, when I'm seeing patients, I was co-managing every patient. So I work at Boston Medical Center very closely with the glaucoma specialists. And so, it was almost like every other visit, patients were seeing both of us, and we were co-managing together. But for, mild to moderate glaucoma, where the patient is comfortable being on eye drops, I will typically manage the mild glaucoma in office and then consult out once we're getting into the moderate stage. Now, with that said, if a patient is really young and they really don't want eye drops, we talk about eye drops versus laser options. A couple studies show that SLT is most effective when eye pressure is higher, and brings a bigger drop. And so for those patients that really don't want eye drops, I send them right away, because they're best managed using all their options. They shouldn't just need to stay on eye drops because they came to me first. And I don't do those laser procedures. So those are always going out to one of the glaucoma specialists that I work with.
Yeah, I think it's a comfort level. Every optometrist, every ophthalmologist has a certain comfort level of treating glaucoma. And when they feel like they're not quite able to offer the utmost confidence in that, they send them out. I think it's a great approach as well. I'd love to ask Richie, bring you back in here, my friend. Any advice on those patients who are on multiple drops? I'm a big SLT fan, first line, so I'm with you on SLT, but we do still have to use drops, unfortunately. Any advice on how to make sure you don't forget them? Anything you can help our patients out there?
Yeah, absolutely. And I say this as someone who's also had SLT in both eyes. I am still on a drop, so I'm only on 1 drop twice a day now. Quite honestly, it's like same deal with me in work. If I don't put something down in my calendar, I'm going to forget it. So I have an alarm that goes off twice a day, 10 a.m., 10 p.m. I know exactly what it's for, and that makes it a lot easier for me. So definitely recommend, if you have multiple drops, you're afraid that you're going to fail to remember, or difficulty with the scheduling, use that alarm on your computer, on your phone, whatever works best for you. Really helpful.
That's a great point as well. I think for me, it's always hard to know what's happened to the pressures, that not in when they're not in the office, right? I mean, we have precious patients come in. I'm sure, Sarah, you have patients come in at different times of day, sometimes looking at what we call a diurnal curve. Are they going up and down throughout the day? But, sometimes it's hard to know what's happening outside the office hours. Do you have that issue too sometimes, Sarah?
Yeah, very much so. I think bringing people in at different times of day and trying to take note and of when the pressure measurement is important, so that when you go back in the chart and you look, kind of which times a day were which of the visits. And I know we have plans to talk about home pressure measuring. I think the Icare home isn't appropriate for every patient, but has been really invaluable in some of the patients in whom I've used it. I know Judy is a home Icare user.
Yeah, I want to get Judy's opinion on this, because I think it's a new topic that I think more and more people are utilizing now, being able to check the pressure at home in a safe way to give us a little bit better insight to what's happening. There's some patients who come in, the pressures are wonderful, low teens, 12, 13, 14, and they're stable in the morning and afternoon, but then they go home and they go up to 16 or 18, and for that, some patients that might be an issue. So let's do this. I think there's a video we have from Barb to explain what this idea of Icare home tonometry is, that you can kind of rent a unit, take it home with you. And then I'd love after that video to have Judy kind of share her experiences with that as well. So if we can cue up that video right now, that'd be fantastic.
Thank you so much, Paul. And thank you to the Glaucoma Research Foundation for inviting me to give you this short overview of My Eyes LLC. So why did we start My Eyes? Well, we started My Eyes really to help glaucoma patients better manage their IOP. And the co-founders are myself. I'm a glaucoma specialist. I'm passionate about this area. Paul Margolis, who's actually my co-founder, who's a patient himself, and Chris Epperson. And Chris is my ophthalmic technician. So you've got three people that understand glaucoma and are passionate about helping patients. We know that IOP is still the only modifiable risk factor. Clinical studies have demonstrated that if you lower the IOP, you can, in fact, slow down disease progression. Key piece is greater fluctuation during the day actually is associated with glaucoma progression and optic nerve disease worsening. And it's also well known that glaucoma progresses despite well-managed IOP. And that well-managed IOP is generally the IOP that the doctor is checking in the office up until now. So my patient, Paul, actually taught me the importance of knowing IOP at different times of the day. A 67-year-old gentleman, he suffered from controlled glaucoma for years. His IOP in the office for years was maintained between 12 and 14. He was able to get access to an Icare home with quite a lot of challenges, but it was that Icare home at night that actually showed that his pressure was spiking to 28. Because he had such severe glaucoma, he was in danger of progression. And this information of a pressure spike at night actually changed his medical course. He immediately went to surgery. And we wondered, how long did we believe he was controlled? And he was. He was having good pressures in his doctor's office, but it was the additional information that really enabled us to better understand his disease and the progression. The Icare is a simple device. In 2017, the FDA cleared it, and they actually cleared it as a prescription device intended to be used as an adjunct therapy to routine clinical monitoring of IOP of adult patients. It's currently only available for purchase. It has been a challenge for patients to get access to this, and it's quite expensive. After seeing Paul's results, we actually questioned, do patients even need to own it, or can they just rent it? And it was Paul who said, my co-founder, who said, there must be other patients like me that could benefit from it. So what we wanted to do was provide patients access to the Icare home. And we decided that we were going to help pave the way to preserving sight. And what this means is that we can provide access to the Icare home tonometer, even as a short-term rental. You can also have access to buying it if that's what you would like. What it does is it allows you to have a better understanding of IOP fluctuations, both during the day and at night. And I think as a glaucoma specialist, this is where I'm really gaining so much insight into this disease from my patients when they check their pressure at night, primarily a few hours before they would wake up. So if you wake up at 8 in the morning, maybe check your pressure at 5 in the morning and see if that pressure is spiking. Also, you can see if your pressure fluctuates with exercise, with daily activities, with coffee intake, all the things that we always questioned and wondered if certain activities are actually affecting your IOP. It also allows you and your physician to visualize and follow those IOP trends, real-time data and graphs. And lastly, what this IOP data information gives you enables you to make changes in your therapy. And like Paul, we completely shifted and realized that we were not controlling his IOP with medical management alone. We do know that if we reduce the IOP variability and decrease that fluctuation, we can slow down progression. So how do you get access to the Icare home? Well, you can rent or buy it. It's shipped directly to the patient. We do need a prescription. All the information is on myeyes.net. If you Google us, www.myeyes.net, you can upload the prescription or you can mail it to us, info@myeyes.net. It ships directly to the patient, easy to use, real-time support. We have an ophthalmic technician who's available to you 7 days a week to actually help you use the Icare home. There's no cost to the referring doctor. The cost that is used to rent it can also be applied against an actual purchase. So it's up to you. You can rent it short-term or you can end up buying it. And again, thank you to the Glaucoma Research Foundation for putting us on your resource page. We hope this helps our patients. And with that, I'll turn it back to Paul.
Oh, that was a great video. Thanks for that nice summary, Barb. I'd love to hear, I've used it. I know Sarah's used it for her patients as well. And I'd love to hear those of you out there, like Judy and Richie and others who've used it. Judy, I know you've had some experience. Tell us your experience with Icare Home.
Sure. I've had the Icare now for about 3 years. I purchased it, was in my doctor's office. He showed me how to use it. It's been pretty accurate. I've had to repair it one time. But I think what it's helped is, as we all know, our IOP fluctuates during the day based on maybe right at sleep time or right after workouts or right in the mornings. But I think what I found is not to be fanatic about it, not to do it like 200 times a day, not to stress about it. But it's really helped now. I just had a Trebek and a revision. So it's really helped the doc now to see where the pressure is, when I need to push, when I don't need to push, or when I needed to go back to surgery, what the pressure has been. But besides, as we talked within the panel, all of us as patients, Tanya and Richie and I, besides the IOP, we have to also consider, the holistic of ourselves as an individual, the fact of our mental health, the fact of our physical health. For me, my faith has been very important because it's a disease that's so unique to each individual. And as many researchers like Dr. Wellesby's talked about, is also a cellular health. So besides the constant focus only on IOP, I think I try to really be very grateful right now that, my glaucoma is stabilized. I have a great doc at Ohio State University, which is where I live in Columbus. So I think besides just the constant concern or fear of losing your sight, to have the faith in my docs and to have the gratefulness of the sight that I have. So that's been very important for me.
Yeah, that's a great point. Thanks for bringing that up, Judy. I think it's important that we as providers, and Sarah, I'm sure you can attest to this, we sometimes get so focused on the disease itself, making sure the pressures come down, treating the optic nerve and look at the nerve. Let's step back sometimes and realize, okay, this is a whole patient. What's happening in their home life? What other systemic diseases do they have to deal with? What is their risk, or let's say, what is their issues with compliance with drops? And so, Richie and Tanya, what are your thoughts on that? On what advice do you have for us as providers on how to make sure we address the holistic approach to the patient?
Yeah, absolutely. I think it's a fantastic question. And one of the things I've been thinking about as the panel's been chatting here is really the importance of communication. And, it's so easy as a provider to get laser focused on the disease, right? But it's also really easy to sort of assume that the baseline the patients have is the same baseline you have, assuming patients know how to take drops appropriately. Paul, I think it was the last patient summit. You shared a stat that had really stuck with me. I'd always known, what is it, like 40% of patients aren't taking their drops correctly. And the ones that do, another 30% have certain issues, but you were talking about the actual absorption of the drops, and it was like 5% of the targeted medications getting to where it needs to go. I don't know how many docs I've seen, but I can tell you no one has ever actually taken the time to show me, so here's how to take a drop correctly. Here's what you do after the drop is in the eye. And no one ever has talked about why we're taking the drops, why it's important. I mean, we talk about pressure, right? And we don't necessarily need to hear about the mechanics of what's going on in the eye, but I think it's really important to really provide the context of patients as well. Because as I think was mentioned by a couple of patients on the line, drops in the scheme of things could be 1,000 times worse, but they're not convenient. There's redness, there's irritation, there's burning. I think if more patients understand why it's important and how to take them correctly and what that can potentially mean for your health, I think you're going to get fewer questions from docs about adherence and compliance and how can we make patients do better. It's really about what's keeping the patient from having optimal outcomes here, as opposed to, what are they doing wrong? So I think it comes down to communication and that baseline understanding as well.
And just to add on that holistically is that patients are not doctors. We don't need to get involved in the mechanics of what happened, how it's going to be treated, the pressure going up and down. We just want to know that, hey, our pressures are down and we're not losing any sight. We also have to understand that there's a whole spectrum of things that we go through as individuals outside of when we leave those or medical profession offices. We have work, some have family, we have children, we have basic everyday problem like everyone else. And the simple thing is that if we get upset or angry or frustrated, our pressure can go spike high, just like that. And we have to be very careful. So I would definitely recommend persons who are new, first time being diagnosed with glaucoma is first take it easy. Learn a lot about what the condition is. Find your own routine and rhythm as to how you are able to take care of you. You're not treating glaucoma. Just let's forget about glaucoma for a little bit and focus on treating you as the individual. And create your own morning routine. Read your books to ensure that your mental health is on point. Do your yoga stretches. Not every exercise is what I will call glaucoma friendly exercises. So ensure that you're not going to the gym and you're doing all that and then your pressure is going sky high. You want to ensure that less is more for you as a glaucoma patient. You want to ensure that you create an atmosphere that you're going to be loved and appreciated, because you're going to need social support. Because I can tell you, when I was first diagnosed, I got depressed real fast. But when I found out more about the condition, when I found out that, hey, I have a choice, I'm not blind and I'm not going to be blind, because the fear of going blind is something that stops us, many of us at the time, and then we get stuck. So you have to try not to get stuck. Keep your morning routine, and as the panel mentioned, that hey, have your alarms for and. You mentioned a pretty good point as well, because not a lot of doctors take the time to say this is how you're supposed to take your eye drop. Not a lot of doctors take care to say what do you do after the drop is in your eye. So there's a lot of things that us as patients have to do and figure out by ourselves. And oftentimes you don't find a lot of literature that is being written on glaucoma from patients themselves. You find a lot of literature that is written based on medical professional, and after time these stuff don't really apply to us. So it's pretty awesome that we're actually having this conversation today where we can share our experience as glaucoma patients in terms of how we are able to do so. For me, holistically, one of the things that I did is that I compile all of my thoughts and my feelings and I put it in a book. And I basically just share that with the world. That way, other persons out there who don't know what to eat and what type of food that they should be eating when you're diagnosed with glaucoma can also have that. Because when I was doing my research, I didn't see a book. Every time I Google a book about glaucoma, I see everything medical. And I just didn't want a book about medicine because I don't speak medicine. And for us as glaucoma patients, we need to have that bridge that explains that medical aspect, but also explain that patient aspect. That way we're better able to still be ourselves at the end of the day. Because glaucoma is not a life sentence, it's just a disease. And once you focus on yourself, you'll get better soon.
Wow, that was fantastic. All three of you, thank you for those comments. We only have a few more minutes left, so I want to bring in Sarah and Alicia real quick. So thank you again for those comments. In terms of education, I'm hearing from our patients here that we got to do a better job of educating. In your experiences as for your practices, do you find that the education leads to better compliance and happier patients just in general? And how do you educate? What's the best way in your practice?
Yeah, I definitely think that education leads to much better compliance. One of the things I started implementing in the last year, especially when telemedicine and the coronavirus kind of, I would say, catapulted telemedicine, is whenever I deliver a new diagnosis of glaucoma, I do a 1-week phone call follow-up where I just call the patient and I say, okay, I want to review everything with you one more time and see how you're feeling. And oftentimes I find that a lot of what we talked about during that first overwhelming visit, where the patient was given the diagnosis by me of glaucoma, isn't necessarily remembered. And that's normal because that's the first day they're hearing something that they probably didn't want to hear. You never want to go to a doctor and hear something's wrong. And sometimes even for me, if I go in and something's wrong, I sort of black out. I don't always hear each thing that's coming after that. And so I find those 1-week follow-up phone calls to be really helpful because we go over drop installation again. We review the drop schedule again. And we also review some lifestyle changes and make sure that, we're starting to adjust to the diagnosis and coping with the new diagnosis. And so, yeah, I found that to be really helpful. And since doing that anecdotally, I've seen much easier compliance, much stronger compliance in those patients. And we are surveying it now, but I don't have a study to prove that it definitely increased compliance.
I love that follow-up.
Yeah.
That is fantastic. Great idea. I guess for the sake of time, we have almost a few minutes left. Sarah, I'd love to hear your thoughts before we go on how you educate and any advice for those patients out there and also educators out there.
Yeah, I would say that I try to duplicate both what I'm saying and what I send home with the patients. And in particular for eye drops, for laser therapies, and for all my surgeries, I review, my instructions in person, but then I also have pre-written sheets on those topics that my front desk prints at the time of checkout. I think on the one hand, I sometimes feel guilty sending patients home with paper and with materials, but I think especially when you're introducing something like SLT for the first time, in the office, I say it's beams of light and it stimulates the natural drain to work better. But then I have a 2-page sheet that what is SLT? Why are we doing it? What can you expect on the office visit day? And I think that offers a lot of reinforcement. And it's also helpful because especially right now, I feel like spouses and partners and advocates are coming to the doctors with their patients less often. And so I think having something at home lets them review with those people. And when they say, oh, did she say this? Did she say that? It's usually on the printout so that they can be on the same page. And I think that's made a big difference.
That's a great point. And in fact, I'll just leave you with one more thing too. Because of COVID, we haven't had a lot of our family members who are normally there. We've actually had some Zoom. We had to kind of Zoom in family members so they can be there at the meeting as well, at the visit. Because I think it's so important to have your family members involved so they can help also with compliance and help educate and remind the patient, hey, I know you were stressed out at the visit. Don't worry, I took track. I kept track of what the doctor was saying, so that helps. Guys, I wish we didn't have to stop here, but I guess we're supposed to stop now with time. But this is so fascinating for me as a provider to hear the patient's perspective. It's so important. So thank you for taking the time to share with us your perspective and helping others out there. Thank you also, Sarah and Alicia, as well, for yours.
You're
Thanks
very
so much,
welcome. Thank you
everybody.
for having us.
Hi, everyone. My name is Amy Dixon. I'm a visually impaired athlete on the U.S. Paratriathlon national team, training and racing towards the Tokyo Paralympics this summer. Thank you for attending today's summit with GRF. You, by attending today's summit, have taken the first step towards beating invisible glaucoma. It's really important that you're your own advocate and you surround yourself with the best possible team. Educate yourself, advocate for yourself, and fight this disease together. Thank you to Platinum sponsor, Aerie Pharmaceuticals, for helping me get the word out about how together we can treat and beat invisible glaucoma. Have a great summit, everyone, and thank you for being part of my team.